Sir, yes, sir.
Yeah, thank you and good afternoon to chairpersons, the senior people from the AIOS office, and the dignitaries sitting in the front row, and my dear colleagues. Dr. Davis has talked about Disha. He created Disha. He was himself there to talk about his institutions. I am very fortunate, very lucky person to talk about something, some institution which was built by a person way back in 55 years back, and person like me who was nowhere at that time to speak about the institution is a great honor to me today. And as people say, I've heard of movie, Shah Rukh Khan's movie, like his name used to be Rahul. They say naam to suna hi hoga. Similarly, RP Center, everybody knows. It's been a pillar of institution for the country. And what to say about that? Whatever I say is going to be a very small thing for such a great institute. Everybody desires to be in a greatest place for education. And India, as such, looking into ophthalmic training, nothing bigger than that. For a basic training, for a super specialization also. And people have to be really lucky, and one of that is me coming from a very small place of Uttarakhand. I would just read a few lines which we always publish in our annual booklet. Vision and far sight of one man developed a National Institute of Ophthalmology, thinking that it will be the forefront of eye teaching, planning, research, and education. And that changed the department, which you all know at that time the ophthalmic department used to be a very small one, clubbed with the ENT in one small room. He made it to a center. And that was a sea change the concept of entire medical education fraternity to think the ophthalmic department can be a center. And that was a person named Professor Lalit Prakash Agarwal. I think we owe to him, the entire country owes to him that he made this type of culture. And this was center to begin with. Things have changed so much, but our motto has not changed from darkness to light. And we always talk that every patient coming to our center should really get light from his darkness, not only vision wise, but physically, mentally, ethically, spiritually, without distinction of caste, class, and creed. I think that is what nations should talk about. For an ophthalmologist working in various places, why not in RP Center? Always look into use your skills, which you have been imparted by education, to restore the vision of all people coming to you and give them a quality of life. Students come from a area where they have no actual knowledge of ophthalmic scenario. Now MBBS has changed so much. In AIMS, there hardly any exam for a ophthalmic division. So they directly enter into the post-graduation, and our job has changed so much now. In our time, I had a colleague who had done, 1 year or 6 months of house jobmanship in a hospital, would have done 2,000 cataract surgery before joining RP Center. So those are the things which are not going to come back now. Teachers have a responsibility to really impart the skill to all the younger generation, not only the clinical skill, surgical skill, but actually teaching the ethics and the correct way to practice for future. And all paramedical and the staffs have to really work for their areas. And this is what we talk about. Our mission is to really create a world-class structure for our country where we can provide the super specialized care to our people by producing the super specialized people from the center, because we do have a largest residency program. We are looking for an eye banking system which is going to be required in every corner of a country, and a community care which is beyond, I think at this stage also not reached up to the actual community area. So I'm just going to take about few slides to have you reach that or thinking which RP Center was created by the country at that time. So there are three important pillars of ophthalmic care, and that holds true for RP Center also. Teaching, research and patient care. I have reversed the slide because this was a mandate from the parliament that Institute of National Importance, All India Institute of Medical Sciences, will do teaching, research, then patient care. But unfortunately, the things have shifted so much. Now we are doing patient care, and very little towards the thinking from the government on the research and patient and teaching wise. But we are still trying to improve those areas also. These are the legends who created RP Center. I'm just come up to talk about these people. Not only these chiefs of center who have devoted their life, the faculty of RP Center, the staffs of RP Center, and the people who have come from RP Center, they have actually created the legend in ophthalmology. Patient care wise, I think this is one very important slide. Right from the beginning of RP Center's inception, Dr. Agarwal thought about a multi-specialty working area, looking at different areas of subspecialties. We have now more than 20 subspecialty in the RP Center to look into, right from a basic, you can say cataract refractive to a ROP clinic now. And these have really been a role model for other people to follow. And the country has actually taken the lead and they've done that. And actually this model has been emulated not only this country, the other countries also. And this is how we started from the basic surgery to microsurgery in Dr. Madan Mohan's time. Started advanced diagnostic modalities in 80s. Subsequently, Dr. Dada, who took up the area into advanced modalities in the field of cornea refractive and glaucoma. Those are two areas he considered would require a future expansion. It is still true, glaucoma requires a much more than what we have done. Then at retina clinic also. These are various labs which have been equipped with one of the most, I think, effective utilization of equipments. People talk about why institution purchasing so many equipments. We have so much a load of people coming to us as students, they have to be given access to these. These research labs have given us the amount of research which we're doing. In fact, RP Center AIMS has been a leader in a government setup for establishing all ultra-modern things, right, from lasers, retinal lasers, examer lasers, to name anything. And now we are working on a community-based areas for low vision services to various areas, giving a rapid assessment in a community in various areas for which we can plan through the government to implement those things. These are world-class facilities, which I think people sitting here would say it's difficult for a government setup to create such a system. But luckily, being an autonomous institution, this has been possible to us. And every year, our budgets keep increasing. We buy equipments worth around 30 to 50 crores every year, and not for actually for our patient care, but it goes for a teaching and research, which is important. I always reply to people. They ask why you not teaching basic things. I like to produce people who think for a future. They take the country beyond what is in a basic level. These are world-class facilities we have. In fact, this is our most recent one. For last 4 or 5 years, we have been doing brachytherapy in northern India, one of the few facilities there which is not available. And RP Center created this, which caters to a large number of poor patients coming, and this is free of cost to most people. And this is the latest. We have been doing surgery now off microscope, digital surgeries. Imagine we started with the intracapsular surgery with the loupes and naked eye. Now we do again the naked eye surgery through polarized glasses, seeing the screen, come back to same area. We started sutureless surgery, we're doing sutureless again. Eye banking is a dream for everybody who's working in the anterior segment. Started a year before RP Center was created, and we have done not bad in eye banking system. We have modernized the eye banking. We are looking for a centralized community eye bank if possible in Delhi to where we can cater. And this is the ranking which every year we get #1 institution in the country in regards to patient care and teaching, mainly because we have a large number of students. They're the best in the country, and they do quite a good work and research, and the infrastructure which government has supported us. And I think this particular slide is important. It was in early 70s, 71, 73, where first survey of blindness was done through ICMR funding at that time, and this created the National Program of Control of Blindness and Trachoma Control at that time. Now it is known as NPCV, visual impairment. And 1976 was the first survey came up, and that generated the blindness program, not only in this country, across the world, and this is the first blindness program in the country. Dr. Agarwal had a vision, and he deserves the, all the accolades for this particular work. We had been a part of a WHO collaborating center, 8th center in the world, and cataract blindness wide outreach was earlier approached. Now we have the patient coming to hospitals because of various reasons. In that, I think, would change the concept in the country also. Research-wise, RP Center is very fortunate to be a part of a great institute, All India Institute of Medical Sciences, where every facility can be clubbed. Now we have various institutions in Delhi, like IIT Delhi and other research areas which we part. This is the last year's publication, just 1 year during COVID time. We had 322 publications, chaired sessions, and 538 papers been published last year, and 96 funded projects are going on. The huge number of work goes in RP Center, and these are around 40 articles on a COVID-related things also. And if you look into our various research areas, blindness was the major category. If you look into 1971-74, it was 1.38, the prevalence. Now in 2019 assessment, it is 0.36. So India has done well. The planning is come down to 0.25 by 2025. And these are various national importance survey we have done for blindness and diabetic retinopathy. This is a trachoma survey we have done. And now in 2017, with our work across the country looking for a trachoma, it was declared that active trachoma free is our country. We are doing now work on a trachoma sequel looking to these areas. Teaching wise, you all know we have the largest residency program in the country. At a given time, we have around 110 junior residents doing MD and around 55 senior residents in different super specialties, and around 55 faculty. The 200 is the strength of people working in our RP Center in academic areas, apart from the other areas. One of the best thing I heard from my colleagues from different institutions, the type of postgraduate teaching in RP Center is totally different. The best side teaching has been one of the major aspect of RP Center teaching, which actually takes the learning from the senior colleague to junior colleague within a fraction of a weeks. Within a week, the person is supposed to be expert in a RP Center. This is a surgical skill. I think one of the best center we have in a country, where we have absolutely ultra modern facilities for our training, which is important for all the medical institutions. And we have simulations, we have wet lab training by Goat's Eye. And not only for cataract, we have developed for all areas of ophthalmic surgeries, and these modules have been created. And now every resident has to go through these trainings. Unless they get a certification, they are now competent. They are not given a surgery in a human eye. These are our workshops. Earlier in 1970s, 80s, we used to have a 2 weeks workshop in RP Center in different specialty. Things have changed. We are still continuing them. And that gives teaching for not only for our people from various parts of the country. The short-term, long-term training is one of the major attraction for people from various background, in not only for government organization, private sector also. Army is one of the most suited area for us, because they come for more than 2 years training in RP Center. Most of them are trained in RP Center now. This is one slide I thought I'll show it. Our alumni people are across the world. They've done wonderfully well. They've created various institutions like RP Center, and they have served the various societies also. I was just checking how many people are there in AIOS as president. One of the largest number of people served AIOS is from RP Center. So we feel proud of that also. So these are 3 pillars I talked about. We have really achieved things in last 55 years. At present, I am supposed to be a chief, and I feel very proud what our seniors have done. I hope that we can put another 1 block in RP Center. People might remember us teaching research, patient care. I would like to go in the same manner, giving importance to teaching and research. Patient care will follow subsequently. Thank you again, RP Center in service for our country for so many years. We'll do it for another 100 years. Thank you again.
Thank you, sir. It was a excellent talk. I think every ophthalmologist, most of them sitting here, everybody would have dreamt of doing their post graduation or UG from RP Center. Just you are telling that your overall motto is to teach the students. I think you are part of most of the government committees also. One request from our side that I think when you are modeling, because we nowadays PG is coming to the institute wherever they are doing the fellowship. When we ask them, have you done the cataract surgery? Sir, my cataract surgery देखा है आज तक मैं शुरू नहीं किया sir. After finishing 3 years of
You can send
postgraduate.
them to RP center. They will do
Yeah.
cataract
So
surgeries.
since you are in a committees, I would request you to formulate such a guidelines to the all the medical college that minimum number of this much of teaching experience and surgeries they have to give to the. I think this is a request from our side, sir.
No, no, I think the guidelines have always been there. It's there also. Unfortunately, it's the institution, the department, they are not actually doing that which is supposed to be done. The guidelines have always been there. We can reinforce them. And I was just seeing the one of the WhatsApp groups recently. There's a lot of discussion on how to make the log books, other things. And they have been there. I think you're right. We should insist they should improve the teaching area also.
Thank you.